Oh, right. Welcome everyone to the amazing XR News Med Health Edition. Normally, our great host Rachel D is here. She's having a little bit of technical difficulty, so my name is Laurel. I'm the Director of Educators and VR Producers of this event. I'm stepping in today to be with the incredible Shannon Putman. I am so excited to be here with you. Yay!
Yay! Me too.
Okay, let's go through a few of the little details that need to be covered, and then we're going to come back and pay 100% attention to you. So, Educators in VR produces the XR News we have since 2018, and we do it every Wednesday here in the amazing Engage XR. On the first Wednesdays of the month, we have this event, which is our Med Health Edition, and on the third Wednesday of the month, we have the Innovation Spotlight with Maxwell McGee, Dr. Tom Furness, and the incredible Chris Madsen, where anything can happen. You know these people, they're crazy people. We have way too much fun with them. And the rest of the time, we bring you the XR News, the news that you need to know from across the metaverse. You can find this show on our YouTube channel, and all of our links to news and references and articles and whatever's happening, the latest news, is on all of our social media channels. Please subscribe to all of these so you can keep up with what is going on here. This event is proudly sponsored by this amazing list of sponsors, including the Reinhardt Foundation, Girls Team Institute, Vertex Form 3D, Bridgemakers, Immersive Learning Research Network, also known as iLearn, having their conference right now, I believe, or next week. It's coming up soon. The Virtual World Society and Cadets Metaverse, and the incredible Engage XR, the platform that we are on right now. All right, I want to introduce you all to Shannon Putman. Now, she's going to tell us all about herself so that I don't have to, because trust me, we're going to go on an adventure ride that's going to just be absolutely amazing. And we have known each other for way too long. We've been doing this for many years, and you also hold a fascinating record for your work in Kentucky. Tell us about that.
Yeah, well, thank you so much. It is absolutely an honor to be here anytime I get the opportunity. I love coming and cutting up with you guys because it is always so much fun. And in order to learn, I think you need to have some fun every now and then. And so it's great to be here, and I love chatting. I started out as just a special education teacher in an elementary school in Louisville, Kentucky. It's where I started out as the assistant, and then I took over as the teacher after the first year. I got into the University of Louisville and earned my master's as I was teaching, and then got introduced to VR in 2016 and have been dedicated to it ever since, and completed my PhD from the University of Louisville in 2022 for technology as educational interventions focused in immersive learning. And so what I tell people is that I work with people that need to learn. I've been kind of pigeonholed into like classroom education, but I'm not complaining about that at all, but the subject is really of no consequence, and neither is the student. If you need to learn something, I can help you, and this technology can help you. And so that's the work that I love to do. And about 2 years ago, we rolled out the largest VR initiative in American public school education. We deployed 2,450 headsets across 30 counties, and that was in partnership with the Kentucky Department of Education. It was still very new, and all of the things that I knew could be the potential pitfalls are what happened. And so it taught us a lot, and that technology is still being utilized today, and couldn't be more excited to help continue to bring, even though I'm originally from Syracuse, New York, go Bills, but continue to bring these resources to everybody across Kentucky and beyond.
Cool. And how many? Tell us, like, how many headsets and stuff? I mean, these numbers are just amazing that you have deployed. Tell us.
Yeah, so not a lot of people like know about it. Like I don't know why, but yeah, we deployed 2,450. We're at 30 area technology centers. Each center got, which are high schools, each center got 70 headsets, which is a lot of headsets for one location. So I'm not advocating that everybody needs to run out and get like 70 headsets for their school, trust me. But we were fortunate enough, we had COVID funds. And so we really put a lot of effort and focus on getting some of the technology, and then, expanding software options, all those kind of things. But we wanted to get the technology out there into the hands of the students where it matters the most.
And you come at this from this world of expertise that tapped into every single element. So you're not just bringing some headphones into the classroom. You're also working with the budgets, the planning, the instructional design, full-blown curriculum, all of the things that are happening in it. And you've learned some valuable lessons, and that you brought some slides to share. Let's talk about this.
Yeah. So when we're especially focused on the medical field and medical careers, I hear a lot, and I see a lot on LinkedIn and stuff, and people are talking about, well, we've got this great software, and we got to target hospitals and everything else, and I hear that all the time. And I'm also married to a gentleman who is an RN, and now he's on the informatics side. So I've learned that if you're trying to sell like a nurse instruction program or any of these things to a hospital, there's a couple of barriers. If it's not like Cerner or Epic or one of the major big boys, and it's an out, third party, Cerner or Epic, they're probably developing their own. And so the hospitals are going to go from within, or they expect you to show up day one. They ready to go. They are not there at the hospital, at the rehab facility. They are not there to teach you how to be a nurse. They're there to train you for their location and what you will be doing there, but they expect you to know a whole bunch of things before you get there. So all of this instruction that we're focusing on in education needs to take place earlier than that. And so we really focus on getting students into the correct career field and preparing them for when they graduate high school, stepping onto the job day one.
Which is how that's one of the things that I've always felt with education, is that we're going to prepare you for the intellectual process, but we're not going to prepare you to actually do the work. Right. It's all great that you understand how a syringe works, but you don't really understand how does it feel to actually have one stuck in your arm, and how do you deploy it? There's so many things, and VR is perfect for that because you can bring in that realistic training experience. You can actually emulate that. And as we know from the beautiful work that's been done, even right here in Engage XR with firefighters, is with River VR, is you get to do it over and over and over and over and over again, and the cost does not increase. Where
exactly, and
when I studied medicine a long time ago, and we would take the syringe and we'd put it in an orange, and I thought the cost was in all these syringes that we'd be sticking into the oranges over and over and over again. They said, no, it's the oranges cost too much money. But it was, they all cost money. The syringes cost money, the oranges cost money, whatever it is. But in VR, those costs are minimized. And so the students get to learn before they walk in the door. That's brilliant. And that is a great expectation. And then you have these great numbers here. Again, very profound.
One thing that I've found, and this kind of leads into that project that I had mentioned that we'll be launching in the fall that I'm really excited about, is that in Kentucky, we do a fantastic job and I use the CTE term broadly. What qualifies as career technical education now is, a lot broader than what it originally was. You've got your classic trade skills, but you've got healthcare, you've got business, all of that in there. We graduate at a 96% rate, which is phenomenal. But what's absolutely abysmal and brutal is that only 38% of those students actually get a job in the career field that they were trained for. And so we are spending all this time, all this money, and we are training these students for skills that they never actually use. And not only is that a waste of time and money, but then our students also are left without a job. So we're not preparing them for life after graduation.
Absolutely. Absolutely. And so how do we change that scenario?
Yeah, so one of the things that I'm really proud of is a project that's going to, like I said, is going to be launching. It's called Putman XR. And a lot of states and schools and districts, they have a bunch of different platforms and they do all these great things, but they're in these silos. And it's always silo. And they don't talk to each other and they don't have this unified system. So, you've got things like career exploration with like Pathful and other things. And so what Putman XR does actually brings everything all together under one umbrella. And so it's a career exploration platform, but so much more. So it takes the last 20 years of experience I had in education and in immersive learning and everything, and it brings it all together. And so there's 4 dashboards. And so there's the student, the educator, the adult, and then the employer. And it's critical for success, and it's for every age. So the students log on, they take a career survey, an interest, like back in the day when it said that I should be a park ranger, which I would have loved being a park ranger. Okay. Like it was spot on. Don't get me wrong. But but that was it. It just told me that. It never told me anything else. How do I become a park ranger? The only two goals I had in life were to be Chief Justice of the Supreme Court or a dolphin trainer at SeaWorld. And it wasn't until my freshman year in college, yes, ma'am. It wasn't until my freshman year in college that I learned I didn't have to have a marine biology degree to work at SeaWorld. So I switched to crim psych. So I was able to accomplish both. And so, yeah. So Prospects takes all that out. So it gives them suggested career pathways, but not just that, it tells them exactly what courses they will have to take. So it's like, oh, I want to weld. I don't have to know math. Like, yes, you do. These are all the courses you have to take. It also tells them real-time job openings in their community. So one of the things that I found in Kentucky that's very different than upstate New York was that people do not tend to leave their community. It's seen as like abandoning your family, even if there's no jobs. And so it's like, okay, well, you need to know that going into it. So if you want to become a neurosurgeon, that's awesome. But you need to know if there is not a neurosurgeon job available within 500 miles of where you currently live, doesn't mean you don't become a neurosurgeon. It just means you need to understand you're going into this knowing either A, you might have to move, or if a job does become available, you have to make yourself even better because it's going to be just that much more competitive. And so
how are you handling this data? Because what that means is you have to have all the research that's localized to Kentucky area, Louisville, wherever. But is that scalable across the United States or the world that you can put in that kind of data?
Absolutely. It's just database. All that information is publicly available. So what we've done is we've just created the system and the databases and it's not even AI yet. Like everybody's like, oh, that's AI. I'm like, nope, it's literally just, we're still good old fashioned surveys. And there are definitely can be aspects to it, but so we have all of that and it's constantly updated. And then it assigns students virtual experiences to try out that career. So we've partnered with some of the best software companies on the planet, in my personal opinion. We've got CareerView XR, we've got GW Pro, a software called VizQ, XREPS, and it assigns them a career exploration. And so that's just to try it out. So they start with CareerView. And in their 360 video job shadowing experiences, it's not interactive as far as simulations, that kind of stuff. We just want you to see what it's like. It's just the first step in your career exploration. And it's tracked and everything gets compiled into a digital wallet so that when the student graduates, all of the certifications, all of everything that they've done is all there. So they graduate with their curriculum vitae ready to go. And it compiles it and it goes with them. And then if they do, so I had to pick software too, that understanding that headsets aren't deployed to the level that we want yet. The software is available on web-based as well with GW Pro and with CareerView. So the headset is no longer a barrier. Of course, the headset is the end goal and that's like the money, level, but it's accessible for everybody, even if you don't have a headset. So
Absolutely.
That was very important.
That's critical. Yeah, very critical. And WebXR is really exciting. We can't walk into it. Well, we can walk kind of into it, but I want to physically walk into WebXR and it's heading in that direction. So you also tackle something really interesting. This one caught me off guard. It's very profound.
Yeah. So the reason, especially I bring this up in the med field. So there are actual companies now that have created olfactory devices that put out different scents. So they match the experience of what you're doing in VR. And so and this was incredibly important to me because it made me think of my mom, because she cannot handle the smell of a hospital. She just can't. Like there's other things she can do, but like she either gets incredibly nauseated or she's even almost passed out at the hospital. So that's something that you think you can handle, but then especially too, according to my husband, he's like, Shannon, you think you understand smells and then you encounter smells that you never thought you would encounter.
Absolutely.
And so if we're talking about a full sensory experience and you look at the history of VR, when it first started, and I started with the Oculus DK2 kit, it didn't have audio. It was connected to the computer and you just had the audio that came out of the computer. And
Right.
that was okay, but there was still a disconnect. Then when they came out
Right.
with the audio on the headset, it changed the game for the
Everything.
immersion. Yep. And that feeling of presence. Well, now we're just taking it to that next level and we're going to that 4D level. And yes, it's fun and it can be like all kind of, you know, some people can be like, oh, it's kind of gimmicky, but it's actually not. If you can't handle the smell, you need to know that now before you spend all this time and everything. And maybe it can be that you get used to it and maybe you can't. But it can
But
also
it's
be used.
critical. It's
Yes.
absolutely critical because if you're, you know, if you're, I have this belief that if you're somebody who loves digging ditches and you're obsessed with digging ditches and you've been digging ditches since you were a kid, then get a job digging ditches, you know. And if you're obsessed with plumbing or helping people with medicine or anything, do that. But there is that issue that you have your passion, but when you're actually doing it and it feels real, so you're either trying to emulate it with a simulation, but then you add the smell to that process, that can either inspire or disillusion people, literally.
Right.
So I think it's brilliant. You have to add that layer of reality to the reality. That didn't sound right, but it's close enough, right?
Yeah, and there's some careers where it might not make as big of a difference, but in something like the, you know, the healthcare field, it does. And it doesn't mean that you still can't work in healthcare, but it just might mean that your path might take a different path. Now, instead of maybe being, you know, an RN, maybe you're more on the, you know, the medical side, or I mean, the research side, or, you know, like my husband is on the informatics side. There's so many different ways you can go, and there's so many different prospects out there for you, which is why prospects shows you all the different pathways.
I love that. I love that. And well, let's get to this next one because this is so brilliant. Explain this one to us.
Yeah, so XREPS is software that I'm a co-founder of, and I'm incredibly proud of because it covers everything that I've kind of learned from as a classroom educator. And so like I tell people, it was designed by a classroom educator for classroom educators, but it's for everybody that's ever been under pressure. And I feel like, not to start singing Queen or anything, which is a classic song, but everybody's been under pressure. And, you know, in the medical field, that can be the difference in life or death. You know, if you're an EMT, if, you know, the whole range of things. And so we need to be able to think correctly under pressure. And so XREPS actually trains the brain. So you play as an American football style quarterback, but what we do is we increase the cognitive load each round, and you're given there's different cognitive drills, and each one targets a different part of the brain that's essential for learning. And then also we work on spatial awareness, which is a skill that we all have, but nobody tends to target, and it is so critically important, and it is something phenomenal that VR allows us to do. Because if I've got a scalpel, a 1/10 of a millimeter, again, can be the difference in life or death. And so I can't get that from watching a movie, a video. I can't get that from looking at a picture, but I can get that in a 3D environment here inside Engage. And so I can target spatial awareness. And we also target the brain under pressure. And so we call them the Jeremiah drills. Because if anybody's ever heard me talk before, I had a student that was my boy, Jeremiah, and forgive me for telling the story, but I feel like I have to every time because he inspired it. But he would come in the morning and he would say, Miss Shannon, I'm not going to punch anybody in the face today. And I'd be like, Jeremiah, I know it. I believe you. And he meant it. Well, then he would get mad and his brain didn't function like it was supposed to, and he'd punch somebody in the face. So 2 things. One, I would tell him, if you can make it, to the end of the day, you can come down and play Creed, boxing game, or whatever game you want and punch as many people in the face as you want, which worked better than anything else. But of course, nothing's, perfect. But then I didn't have anything because by the time, if he wasn't with me when he got mad, by the time I got to him, it was already over, the triggering event. And so other educators would say to me, well, he needs to learn to control that. And I would say, well, do you tell somebody with diabetes to make more insulin? And they're like, of course not. And I'm like, well, that's what you're asking him to do. But because it's the brain, we feel like they should be able to control it. And so then they're like, well, if he does that in the real world, well, no kidding. Explaining a behavior does not excuse a behavior. But if we, and especially he, knows when and why that behavior might happen, we can train him to try to be proactive as opposed to reactive. And it's the reason it's so important to me is because we worked very hard with Jeremiah, and he was 18. He graduated. He was going to start college in January. He was going to dinner with his girlfriend. Some 17-year-old kid said something he didn't like. He instantly responded, and that kid took out a gun, shot him in the chest, and killed him. And so we lost him to split-second decisions of kids whose brains haven't even developed fully. And so what we do in XREPS is I did a lot of research, and I found out, I worked with some top neuroscientists, one out of Montreal, that the same parts of the brain that are triggered and firing when you are agitated or that under pressure feeling are the same type of the parts of brain that are firing when you're competitive. So what do we do in XREPS? We actually put your brain at the neurological level into that same brain state. Then we throw a challenging problem at you, like a fan gets in your face and it's like, you stink. Now you have to make the right decision when your brain is actually in that state. Because I say most of us make the right decision when we're calm. You know, I'm not going to flick you off, but if I had a day and you cut me off in the parking lot, it might be doubles, you know? Or if you look at it, like, especially because, you know, I was a college athlete and nobody ever talked to me about controlling it. And you know, all these different high pressure situations, whether it's a surgery, whether it's doing CPR, or somebody's coding, all these things, it's all the same reaction in the brain. And so we look at last year, the first game of the NFL season, new rookie on the Eagles, he got upset, and in front of all the cameras, in front of the refs, in front of everybody in the stadium, he spit at Dak Prescott, and he got kicked out of the game before the game even started.
Oh my.
And so here it's like it happens to everybody. It's not just a special ed kid problem.
Everywhere. No,
it's everywhere.
It's true.
And
it's
so
everywhere. Now, you see, yours is designed to put someone inside of the mind and body of a football player. What about somebody, again, I'm looking at scalability. I have zero interest in football, and you can football me until I'm purple. I have no understanding. I hate it. I can't stand it. So I wouldn't be a good person for this. But do you have other characters than football? Or
so
is it geared towards that?
The goal, of course, is to scale. And yes, we absolutely want to make it, and especially understanding that, like, even just, you know, students, like, I want to make it so that if they prefer Harry Potter, then instead of throwing a football, they've got a wand, you know, and doing things. Okay. So yes, that absolutely is the plan of, we've built it so that the way we've designed the drills, we can basically kind of rinse and repeat to do the same types of situations to get that brain into that state. But what's funny is I would challenge you to just give it a try, because I've had people tell me that exact same thing. And if you would at least give it a shot, I would at least have you try it. If even afterwards you were like, you know what, I still hate it, Shannon, then fine. But it's less about the football and more about what you're doing. Yeah.
Right. And that's what's fascinating to me, is that this is applicable not only to people with anger management issues, but also to people who are autistic and socially dysfunctional and trying to struggle in today's world. A lot of that comes from the challenge of ending up in situations where either it is reality or they perceive it to be high stress, and they don't know how to decide, and they don't know how to make any choices, period, when there's that perception is there. So I can see this being of tremendous benefit. What a cool thing. This is exciting.
Yeah, thanks.
All right.
It is.
Now here's the reality. This is the absolute reality. The experience is the preparation, and that's what VR does so beautifully. Right?
Yep. And it literally, it is. And again, all of this experience and preparation is not a replacement. It is an enhancement. It is extra reps. It is all of that. It's not, you know, so many times I was going around, especially in the KDE project, and I would be talking to educators, and they were, you know, someone who welded for 30 years, and now they're teaching kids how to weld. And they're like, well, they need to feel that spark in their shoe, and they need to be in there doing it. And I'm always like, of course. Absolutely they do. Like, this does not replace that. But consumables at the prices that they are, you know, resources, just him as being one person and having 30 kids, all of that stuff, you know, we have to adapt. And I always, anytime I'm talking with people about using this technology, and I, you know, I'm always super nice in the beginning, and I'm always very encouraging. And then eventually they get me to the point where they'll say again, well, I just don't really like this. And then I get to say to them, you know what? It's not about you. It's about your students. If
It
we're looking at
is.
it, it is absolutely not about you. I didn't like having to teach, high level physics to my students because teaching special ed, who I was still trying to get them to independently put their shoes on. But guess what? Had to do it. And I found a way to
Yep.
make it work,
Yeah.
so it's not about you. And that's why I built prospects, because as you know, but everybody might not know, I say that my current job at Putman XR Consulting is like a 1950s door-to-door vacuum salesman. I literally lug my equipment, I knock on the door, I schmooze the housewife, I sip her coffee, I convince her that she needs a vacuum, I instantly know what her problems are and how I can fix it, and then I go to the next door and the next door and the next door. But the difference of what I do is that with the next day, when that housewife calls in a panic because she forgot that she actually has to plug it in, I answer the phone on the first time, I talk her through it, and I reassure her, and then I guarantee that she can use that vacuum before I get off the phone with her. That's the piece that's not happening in this. And so while we're doing all of that, understanding that there are ways you can still integrate this without having to fully buy the vacuum yet. And so it's a slow, until we get more vacuum salesmen, and I'm only saying those gender terms because of the time period.
I understand. Yes.
But until we get more vacuum salespeople, then we're going to be continuing to hear every year, VR is dead, it's not working, blah, 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 because we're not taking the steps to make it accepted throughout education. And that's where we desperately need it.
Honey, singing to the choir. Absolutely singing to the choir here. I just love that. Now, you have some surprises for us, and we're going to be going on a tour. So get ready to be moving here. So do you want to tell us about our first surprise?
Yeah, so we're going to first go to an empty recovery room in a hospital, and it's just going to be empty. And so these are the exact same steps that we took with some high school students who were they graduate with their certified nursing assistants, by the way, and these kids are graduating with their associates, which as an 18-year-old, I know that they don't understand how awesome that is, and I wouldn't have either. But now, as an adult with student loans and looking back, I'm like, oh my gosh, that's so amazing for you. But with the CNA course, typically they get placed, and the only hours that they can get for clinicals are in nursing homes and things like that. So the first step that we do now, I don't have the olfactory sense, of course, but we're going to go to the empty room, and then I'm going to bring in some things and show you kind of how we start to basically just shove them into the environment that they will be expecting, waiting for them.
All right. So everyone, hold on to thy virtual buns as we get teleported away. The scene will get black, and then we'll be in a new place. Standing.
Yes. I think I remembered it was on page 9. There we go. I've used it quite a bit. Here we go. And so, it's pretty typical. You can you can obviously add things and stuff like that, but just nice the hospital recovery room here, and there's a couple chairs, things like that. And so we just let them, kind of look around, feel, the actual space, and see, again, it's not obviously, fully exact. We don't have all the EKGs, everything like that, but just a nice little introductory. And then what I do is I play an experience for them, which it'll show me kind of doing an initial experience with a patient and her mother. And we have added certain auditory conditions to this experience this recording that I'm going to play for you, just to give them a tiny little hint of what is kind of waiting for them. And then the third step is I bring in the AI characters and I kind of have them interact with them and stuff like that. And the reason that we do it this way is because a lot of people are like, oh, let's, put them right into it. And it's like, well, no, like that's not how it's going to be even exactly. But if you can't handle all of the other things going on, it doesn't matter how good you are at taking the blood pressure. It doesn't matter how good your skills are. If you can't manage all of the other sensory inputs and all of the other demands that are being put on you. So you might be the most skilled, you get the IV in the vein the first time, every time, but let, a patient's daughter come in and start distracting you and see how you can handle it. So that's why we kind of do it in this step fashion.
Wonderful. All right, we're ready.
Okay, so let me pull in. All righty. Here we go. I'm gonna play it.
You all can unmute if you want to have your commentary and ask questions as we go.
Hey, Carol, how's your mom feeling today?
She's still groggy from the anesthesia, but they said the surgery went well. I'm really watching her closely. Did she already get her pain medication? I want to know exactly when she had it and when the next dose is scheduled. It's important because Mom's been so fussy before. And, by the way, she has dementia, so please make sure to speak slowly and clearly with her, even if you think she understands. She needs that with her confusion.
How are you feeling today, Dorothy?
Blink slowly, looking around with a puzzled expression. Where am I? Is this my house? I don't remember. Did someone say something? My head feels all foggy. I'm fine, I guess. Just a bit off. Why do you ask, dear? Are you sure you know who you're talking to?
Wow. Wow. Is
Yeah.
anybody else deafened by that? That's amazing.
Yeah, so we did that, and I know people think, oh, that's not really going to be beeping and blah blah blah. Like, no, my brother unfortunately had a stroke almost 2 years ago, and his thing beeped all night, and no matter what they did, it didn't turn it off, and it never stopped. And so, if yes, maybe you do become accustomed to it, but in the beginning, let me tell you, and there's going to be hums of machines. That's why we kind of had that going. And now you're not just dealing with the patient who has dementia, you're dealing with her very protective, understandably, daughter who is demanding and asking all these questions of you, and understanding your role as the certified nursing assistant. You're probably not going to know the last time her medicine was given or when it needs to be given again. So you have to have the soft skills to be able to introduce yourself, let them know, let her know what your role actually is as the CNA, and that, without getting her upset and being like, because, if you say, well, I don't know, they're gonna be like, well, who does know? And it could, those soft skills are very important because people are on edge having all these things. And so how do I accurately explain to this woman what I can do, what I'm here to do, and that I will ensure that she gets answers to the questions she just asked.
And not just ensure, but it's really hard to remember things when you have so much input.
Yes.
To be able to know, I need to hold on to these questions to be able to walk out of this room and go find the answers. So that's adding more pressure that they have to memorize these things literally before, and then know who to identify. So this is brilliant. Really brilliant. What do y'all think about it? Comments, questions?
Amazing. Amazing.
Thank you.
Thanks, Jane.
Yeah, like I said, this, and a lot of people, like I said, they like to go right into it and come over and, take the blood pressure and do this, do that, and the other. She hasn't even gotten over to the blood pressure cuff. She literally, or he has just introduced themselves and walked in. Actually, they haven't even introduced themselves. They've just walked into the room, and this is what they're greeted with. And that's the reality of what they're stepping into.
Yeah. I'd like to ask Bruce, what are your thoughts on this? Being that you're working in this, you're doing this kind of work all the time.
I think that it's one of the underutilized areas of Engage is the kind of the spatial recording, and it kind of sets kind of a lot of the metaverse kind of things apart. And I think it is that side of, you can create so many kind of little case studies and little kind of things there. And we're kind of really fortunate about having a kind of space. And so, for example, things like this, and it suddenly becomes a room of requirement, and you can kind of change kind of all of your kind of scenarios and kind of basis is there. And I think that this is one of the things that academics don't realize of how easy things can become. And I think that that's where you end up kind of like role playing kind of like the patient, and you can kind of go through that, do the spatial recording, and then you've kind of got that kind of a kind of case study, the kind of the process straight away. And you can have kind of like groups of people kind of working within this kind of very, very well like this. Like it doesn't have to be a solo experience. And I think that that's the kind of fantastic thing, that it isn't difficult. It's just the kind of the way of kind of rethinking and repurposing. And I think that a lot of the academic staff have already got kind of scenarios and scenario based kind of things, and it's just getting them to realize that they can stick a headset on and then kind of get people to engage with this way.
Yeah, and one of the other things too, especially like talking with my husband a lot and stuff, you know, because he's actually really good with technology and stuff. I would always have great ideas, and he'd help me make them a reality. And you know, I'd have him, you know, talk about a new software or, you know, see something, and he's like, one of the things that there's two things that I've noticed. He's like, a lot of the med software that I see in VR, you know, they're like, no matter what it is, it could be, you know, placing an IV. Like a lot of the times, it was like placing an IV was a big one. That was kind of the rage, and it was like, well, this doctor, you know, recommended it, this doctor, and he's like, just in my experience of being an inpatient oncology nurse for 8 years, he goes, the last time I saw a doctor actually put in an IV, he goes, was never. They do not do that anymore. They have gone past that. It's going to be your nurses. So he's like, I want to know from nurses how accurate this is and how it feels. And then two, the second thing that he always talked about, which kind of goes back to what Bruce said with the spatial environment, is that we can only do that in VR, in where if you're setting things up, that idea that if I bring this tray too close to me, I'm going to turn and knock my syringes and everything off on the ground. Now I have to go get new ones because they're not sterile anymore. And so the space and having the 3-dimensional space is so key, that you know, of what you're working in. He's like, it always felt so much smaller doing things than in like a wide open classroom. Like in a classroom, I had all the space in the world, but then when you get into the hospital or whatever setting, and so being able to do it in VR in an actual limited space was critical. And those are the things that I think are you know, the little nuances that we're not taking as much advantage of.
Absolutely. I love that. Now, what's the next step in this? Oh, go ahead, Bruce.
Sorry. I think that it's also one of the things that people don't realize, and it's like, if you were kind of like jumping on the bed here, is that you kind of like don't realize of like actually how busy kind of people around you are. And the thing is, this is where kind of like in an educational environment, I'm just going to jump out, but in an educational environment, that there's this kind of view of like, all right, okay, that you can kind of have 8 people around a bed, but if you end up kind of being a patient and have 8 people around your bed, it's really claustrophobic. And I think that that's the kind of the sides of getting people to like to jump in and kind of experience of like, what would it feel like being that patient? What would it feel like kind of from other people's perspectives? And that's kind of like some of the fantastic things that you can kind of do, because it's a lot of education is artificial, and rightly so, because it has to do the staging and this whole process of like where you're saying is just like to get everybody fully immersed straight away is like, whoa, you're kind of going from kind of not even walking to kind of like sprinting with Usain Bolt. And the thing is, it's like actually kind of we need to do the baby steps. And I think that this is the kind of people to understand what kind of the environment is, what kind of movement, what space have they got, what kind of things can they do, what can't they do. And the thing is, it's like where you're kind of showing that very kind of short side. It's like, well, actually, you've got to understand if you're doing a ward round and stuff, and you're ending up getting so much information, or you're picking up kind of that information, that document to start off with, of going, okay, who have I got in front of me? And there's loads of things there, but you can kind of have this different personas, different perspectives straight away, which is one of the things that is so good about kind of virtual reality, to use it.
Yeah, absolutely. I couldn't agree more. And so kind of like along those lines of progressing them. So then now what and also the difference too in I think with what I did and how this was designed was that I knew the technology and I knew how to get the a required or desired outcome, but I didn't know what exactly was needed as far as, like the beeping and this sound or that sound. So what did I do? I worked with an actual certified nursing assistant and nurse and nurse educator. They're the ones that told me what they wanted to do, and I was able to understand the tech and make it. But if I were to just make it myself and not even ask them or have their opinion, to me, that's where it feels also disingenuous. We have a lot of people that love designing software for audiences that they've never been a part of. And so I think that's an important step that we always keep in mind when we're doing these things is who is our audience and, how exactly are we going to have people have access to them? And so then what I do then is I'll bring in the patient and the daughter, and then typically I'll start with one person asking just either one, the daughter or the patient, a question, and just I don't give them any prompts. And this is also too what I think is a very, very hard for educators to do, myself included, but I like to see what their thinking is. So instead of telling them you should ask this first, I like to say, what would you ask? What would be the first thing you would do? So if we were to ask Dr. Jane, what would be the first thing you would do as far as interacting between you have the daughter Carol and you have the patient Dorothy? What would be the first question or first thing you would do?
Wash my hands. I would wash my hands.
Perfect. Perfect. See, you can tell she's good at her job. Right. And so, and that's great to know too, because if people don't say that, it's like, well, okay. So depending on what the outcome of the activity is that we're doing. So now we're working on, patient communication. So we've done all that. We've looked at the chart that we're allowed to look at, and we've washed and we've come in, and now we're going to start talking. And so what would be the first thing you would do?
Jane?
And anybody can jump in. Yeah, anybody's welcome.
I would just ask, how are you?
So you can go ahead and do that if you
ask. Yeah.
Let's get beginner finish.
How are you? Oh, Dorothy, how are you feeling today?
Ask her if she's gonna finish her Jello. I don't think Dorothy's quite with it.
Dorothy, how are you feeling today? There we go. Well, she did have dementia, so.
Where am I now? Is this the hospital? I think something happened, but I can't quite remember. Who are you? Are you my Carol? No? I'm sorry, dear. My head feels all foggy. I'm feeling, I guess, all right, but my hip does ache a bit. It's hard to say just now.
So for a little background information, Dorothy took a tumble and she broke her hip and she had to get a hip replacement. And so what I also found interesting, and this is it's so neat to see because Dr. Jane, you asked Dorothy, how are you? I would tell you, I would say at least 50% of the students that come through that are just starting, they start by talking to Carol first and not the patient, because they come in with this preconceived idea of she has dementia, so she's not going to know anything that's going on or whatever, and it doesn't matter. And they'll ask about Dorothy to Carol. And it's phenomenal to watch the interaction. And it's like, okay, well, then you go back and you ask them, well, why didn't you ask Dorothy how she was feeling? And it's like, oh, well, because she has dementia. Well, okay, but that just, you can't have that blanket statement. And so seeing how they actually interact with a family member in the room and what they do, and because I've seen patients are like, I'm sitting right here, talk to me.
Love that. Love that.
And then, Carol's a little overprotective, but she should be. That's her mom. And so then, we'll ask Carol, something like, let's see. Hey, Carol, how does your mom do under stressful situations? Is there anything we should watch out for or make sure that we allow her to be comfortable?
Thank you for asking. My mother has dementia, so she can get easily confused and sometimes agitated, especially when she's in a new environment like this. It really helps if everyone speaks slowly and clearly to her. And please, keep an eye on her for signs of distress. I know it can come on quickly. Honestly, I worry about how she's coping with all of this. By the way, could you tell me when she's scheduled to get her next pain medication? I need to make sure she isn't in pain for too long.
And we can see now just from the two interactions, the one that was recorded and now this one, she's very concerned about her mom being in pain. Completely understandable, but you can tell right away that's something we definitely need to reassure Carol that we're going to make sure that her mom's not in pain. We're taking great care of her. And then the more comfortable you can make Carol, the more comfortable and willing she is to step back and let you do your job, let you take care of her mother, let you ensure that you can work with Dorothy and do those kind of things. And so all of those little nuances, you know, of the communication with the patients. And again, none of this have even gotten started with any of the actual practical skills. It's just what makes the difference in, you know, a quality interaction and how you have to set the scene to be able to work with your patient.
Okay, this is fascinating. What's next? I
Yeah,
love
so
all
well,
the,
so this
yeah,
was
because this is really intricate and so, you know, we're looking at things at almost a micro level. I just love it. So what's next?
Yeah, so the last one is we wanted to put you in the position of, you know, feeling like you are a patient or coming to visit a patient and that first interaction that you might have with the unit secretary. And so because much like in education, I hear in VR, like, especially in the VR industry, everybody's like, well, we got to get a classroom teacher and the principal and get an all-star teacher. And it's like, okay, well, what happens when the teacher leaves? A, and B,
Yeah.
there are so many people that make a school environment run, just like a hospital. There are so many people that make the day-to-day operations run outside of, you know, the initial things that people think. And one of those being typically the first person you're going to see once you get up to that floor is going to be that unit secretary. And so if that's going to be your job, A, we want you to understand how people are coming into the hospital. You know, they're going to be under pressure. They might be, you know, a little bit more rude than you would think, or short or curt. And are you able to handle that? And, you know, you're really the first, I guess I don't want to say like first gate, but you're the first, you know, line of defense basically. So we're going to start out at the front of the hospital and we'll switch on over to there.
All right, here we go.
Mm-hmm. And what I do love about this is that they've already got the sounds and everything going for you, so I didn't have to like add any of that, but I'm going to add the unit secretary. Because typically you're not supposed to just be able to walk right in and go right there. I mean, depends on the floor and stuff like that. And yes, this is Jim. And so then what we like to do is we have the students, you know, come up and we tell them they've got to, you know, they're trying to get to their mother's room and they don't know, you know, or father. Like one of the things too, I like to do, we give them preset scenarios, but then we also have them come up with some of their own scenarios. But they were called and said that they got a call, said their father was in an accident and they need to find him. And so they just come rushing up to the unit secretary and we, you know, have them say, okay, well, what would be the first thing you would do? And then we have them try it. So if anybody would like to try, same kind of thing.
Karen, Bruce, want to give it a try?
Go on, Karen, I've talked starting it.
Yeah, I can do it.
Anybody?
All right. Sorry,
Give
I'll
it
do
a try, Shannon. Okay.
Could you repeat that?
Hi, I got a call that my father was in an accident. I need to find him. Where is he?
I'm going to need your father's full name and, if you have it, the date of birth or patient ID. That way I can look up if he's here and exactly where.
His name is Charles Reeves, and he was born December 3rd, 1921.
Give me a second. Okay. Charles Reeves is not currently admitted on this floor or any other inpatient unit here. Is there a chance he might be in the emergency department or admitted somewhere else?
See, and we
want,
do that
I
on
can help you
purpose.
call
Like
around
we
to check.
specifically start the unit secretary by saying they're not here. This is not their floor.
Good.
Because then instantly that's going to be like, well, where are they? What do you mean they're not here? And just kind of it goes off from there. And so we really like to trip them up as much as we can, so they can feel it from the frustration standpoint of the person who got the call, but then also see how the unit secretary handles it and what they do. And then sometimes, and which is also great and why I love Engage and the updates that they've made, I could do some tweaks with the unit secretary, and I can, with their script, and I can say, hey, you've had a bad day, so you're going to be kind of rude. And we can show them some examples of, of how maybe not to talk to people. And then we start this way, because this activity here is designed to be done with just one student. So if they want to have extra practice, whatever. Another thing that's hard is when you do these different clinics or you do these different scenarios, you have to have a person for everybody, and not everybody always has that many people. So this can be done independently and they can practice. Then we bring in people and we bring in other students, other people, and now we replace the AI character with a real person. And so then they do different scenarios and things like that. And that's how we go along that progression, so that it's not just all at once, and they don't have to have all these skills right at once, exactly at once too, because they still need to learn. You got to think, is this the first time they've ever been in VR? What pre-work have you done before you've gotten to this content specific lesson? Another reason why XREPS is fantastic is because it teaches you all of the things, that the skills that you need to interact in a virtual environment. But if they don't know how to walk, or if they only teleport, they've never turned on smooth movement, any of those kind of things, you have to think about that in the process too. And a lot of people jump past that.
This is fascinating. Questions, comments?
Yeah. No. All right. Well, I thank everybody. This is what we got.
Hold on,
I'm here.
Shannon. It takes a minute to unmute. Bruce, did you have a comment or something to say?
I was just going to say that the thing is, it's just that as everybody realizes that anything that has the word medical kind of attached to it increases kind of like the price tags. And I think that this is one of the things where Engage as a platform is very strong, where you can kind of start to create kind of like these scenarios. And the thing is, it's just that the most valuable resources are our educators, because they kind of have these kind of case studies, these role plays, these kind of things that they can do, and that kind of whole process of putting them together, to have it in a digital kind of way, where potentially as well that things can be set up for people to be able to drop into and be able to do it in their own time and practice, and also kind of like fail, because that's one of the things that you kind of like, I always talk about failing forward. Because it's like, learn from your failures, learn from kind of there. And if you ended up going in with kind of something kind of like straight away, like you mentioned, it's like the mother and daughter, and the conversation isn't to the patient, but it's to kind of the relative. The thing is, it's just learning from that straight away. And I think that this is where kind of the side of, there's obviously there's lots of different simulation kind of softwares out there, but the kind of the price tags that they have are very cost prohibitive. When you're looking at HE in kind of the UK, is kind of over the last year has ended up having to make so many cuts that not everybody is kind of choosing kind of a higher education, a university pathway anymore, because it's expensive. And I think that this is where it's like, well, actually, if we still want to provide a fantastic service for students, but the thing is, it's just that we also need to be very financially astute to kind of like where we're spending our money.
And one of the things that was fascinating, you mentioned like talking, Shannon, to talking to welding, welding teachers and students. Craig Scott, who teaches, is going to be back here doing some training programs on how to use welding, but also photogrammetry and things. He did a cost analysis for a school in Wales that he teaches at, and found that, and I don't remember the exact numbers, but once they replaced the training part of welding with VR. They still had all the equipment to do the real stuff, but when they replaced the initial training went up with VR, their electric bill reduced by something like 80% a month.
Wow.
Now that's something you wouldn't think about, is that how much you turn on one of those welding machines and there you go, it sucks a whole dam's worth of electricity, is flooding into it. It's really expensive. And just a simple act of cutting the electric bill can change things, because it is more cost effective compared to a headset, compared to that electric bill. It doesn't take away the reality. They're training to use the reality, and that's what you're doing here, is you're training to move them into that reality, and a better reality than the most of the training that they would be getting, because so much of it, like we know, is textbook and video and whatnot. This is really moving into as close as they can to being with a patient and experiencing the actual patient medical person relationship, and not involving the cost of hiring people. So again, cost savings on that.
Right.
Yeah, and it really is, it's so effective. Have you done any analysis on cost benefits and factors with this so far, with what you've been doing?
So we did initially with our initial one was because the school that we did this with, they already had the headsets, which was fantastic. So we didn't have to have that initial, but we looked at, especially, and I'm not saying any yes or no, I'm not getting political at all, but you look at the price of gas for whatever the reason currently, that the price of gas alone from going to clinicals to now the main residential facility that they go to is only 5 miles away, but they were going once a week, and we replaced one. They went every other week, and we were able to save in the first 3 months with just fuel costs alone. We saved over, I think it was over 10 grand in just in 3 months in just fuel costs, because they're like, well, it's only 5 miles. Well, yeah, it's 5 miles there. It's 5 miles back. It's then putting the weight on it. It's then the bus coming from the garage over to the school, like all of those things. And that was just gas.
Insurance and everything. So that's something that it's so important that we convey. When you're setting up these things and you're trying to convince people to buy into immersive technology, we have to look at the costs, and we need to look at costs that we're not used to looking at. The gas is one of them. The electricity is one of them. They had the VR equipment, specialized equipment was ordered and paid for by a grant, and it was sitting there for like a year or two with dust on it. And they went, oh no, it's too expensive to use, it's too fussy. They went, okay, well, let's really look at that. You did that with the VR headset. So we need, and that's part of the creativity we have to tap into. What's really the cost analysis, what are really the benefits? And this, I wish when I was training my medical stuff, I wish I had these experiences. I at all levels, for example, working with children. I hated it. I was just walked down to the floor to start a training program in pediatrics, and this kid came from the end of the hallway, ran all the way down, stopped, planted his feet right in front of me, looked up to me and said, "I hate you, get out of here." And I went, okay, good, I'm gone. So I didn't know how to handle having, is this kid dying? What's wrong with this kid? I don't know any of that information. I just know that he just said he hates me and he wants me gone, and all I want to do is be gone. If I'd had that socialization, if I'd had that simple prep, how do you respond to an aggressive child, a student who smacks somebody in the face? How do you handle that? So this is brilliant. This is brilliant.
It's the reality too of like, and for me, it's always emotional connection. But if you look at it, especially in the medical field, I don't always like to reference TV and stuff like that, but I feel like the TV show The Pit has done a really good job of exposing the mental toll that it takes on healthcare professionals. And so what the whole point of doing this and why, and what I tell the students too, is I'm not telling you not to do this. Like that, don't think that at all. I just want you to go into this informed and, you know, maybe having some things in place and knowing mentally what it's going to do to you. You know, like I know mentally I can't volunteer at an animal rescue because it would just destroy me. And you know, but maybe if I were able to practice a little bit more, maybe I could. But knowing what you're stepping into, and this is how you can mentally prepare yourself. I will say for the younger generation, they do a little bit better, at least than I did. Like I grew up that, like, you know, you get up and you go to work. It doesn't matter, you know, like it doesn't matter if you're sick. It doesn't matter, you know, if you know 5 people died on your last shift. You get up and you go to work, and how you deal with it, and you don't deal with it. You just keep going, and that's not healthy either. So we can start to have those conversations that are really hard. And I found that through doing this work that I was growing as a person. And so I was making, you know, advancements with these conversations that I hadn't done. And so even I was growing as an educator. And so, and so was the educator I was working with. And it was like, it makes, when you have those type of wins, then they're more willing to come back and use the equipment, to take the time to learn how to use VR and to do those things. It has to be meaningful.
It has to. And I think if, with all the issues we're having with teacher and medical healthcare professional loss in the industry after COVID, if the COVID was burned people up and spit them out, and if they had this almost neuroplasticity, if they'd had this, you know, really worked on pressuring the brain and understanding how to respond, I think that we would have had less burnout. So this is really, really exciting. I just love this. Any last questions for Shannon or comments? Nope. Okay. And Shannon, I want to thank you so much. I know that Rachel, I wish Rachel had been here, but we'll figure out what's going on with her technical problems. And but I want to thank you so much for being here on behalf of Educators in VR and the XR News. It is what you do is absolutely amazing, and I want to learn more about all of it. So we want you back again at some point. We will have you back without a problem. We want you back, but because it is really, really incredible. Yes, Karen.
Oh, you can hear me. Okay, Laurel, I just had a quick question for Shannon. So, Shannon, when you were showing us your slides earlier on your app, is that something that you have to be a school to be able to purchase that, or can the average person get that app?
Nope, XREPS, anybody can get XREPS. You can just reach out to me. We're not currently on the meta store just because there's all the Horizon stuff going on, all this, that, and the other. But we're working on getting on there as well. But currently you can just reach out to me and go to my website or anything, and XREPS is for everybody and anybody.
Oh, that's wonderful. Okay, I went to the website, so I'll reach out to you. Very interesting presentation. Thank you.
Yeah.
Yeah, thanks you so
Karen.
much.
Yeah, Karen's one of our hosts, along with Steph, who is right behind me, and for the XR News, so I'm glad they're here. All right, so thank you again for being here. Shannon, you know I'm such a fangirl of everything that you're doing, so however we can help, please let us know. And this is, my name is Laurel, I'm the Director of Educators in VR. You've been participating in the XR News Med Health Edition that is on the first Wednesday of every month. Every Wednesday we are here, thank you, in Engage XR, and we bring you the latest news and innovations from across the metaverse. It is the most exciting time to be in the metaverse is right now, no matter what you hear on in the news, in the papers and stuff. We are all you please visit educatorsinvr.com for all of the links to all of our social media, all the links on our news and articles, and this video will be on YouTube, and we will be putting it on our website and sharing it on our socials very soon as well. And I do also want to thank all of our sponsors for the XR News, the Reinhardt Foundation, Girls Team Institute, Vertex Form 3D, Virtual World Society, iLearn Network, the Cadets Metaverse, Bridge Makers, and especially Engage XR. We really want to thank Engage XR for allowing us to continue doing these amazing, amazing works. And I know you're having the time of your life here at Engage XR, Shannon, because this is a great place to be. So thank you, everyone. Great job. Thanks again, Shannon. Yay.
Thank you, everybody. Thanks for having me. I'm just as big a fan. So.